We're going to get started. Thank you so much. Welcome, everyone. Thank you so much for joining Sharsheret this evening to discuss something that many of us don't think about. That is, until it becomes a problem. We're going to discuss lymphedema, what it is, how to reduce our risk, and how to manage it if it does occur. But before we begin, just a couple of housekeeping items. First, if you'd like to remain private, you have the option to turn off your video and rename yourself, or you can even call into the webinar. Instructions are in the chat box now for both options. We also have closed captioning available. To display live captions, on the bottom bar, click Captions and then Show Captions. You may have noticed that you were muted upon entering the Zoom. Please stay muted during the call. If you have any questions for our speakers, please feel free to send them in the chat box. We're going to have a Q&A at the very end of tonight's presentation. I want to thank our sponsors for this program, whose generosity allows us to provide support and education to you. Thank you to Sherry Helfen Wiener, Daiichi Sankyo, GSK, and the Cooperative Agreement 24-0061 for the Centers for Disease Control and Prevention. The webinar, as usual, is being recorded and will be posted on Sharsheret's website alongside a transcript. Remember, as always, participants' faces and names are not a part of that recording. Sharsheret has been providing telehealth services to those impacted by breast cancer, ovarian cancer, those who are living with heightened risk, and we've been doing this for more than 20 years. As we move into the webinar itself, I want to remind you that Sharsheret is a not-for-profit cancer support and education organization and does not provide any medical advice or perform any medical procedures. The information provided by Sharsheret and by tonight's speakers is not a substitute for medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem. As always, seek the advice of your physician or qualified health provider with any specific questions you may have. We have two wonderful speakers here with us tonight. We really are fortunate. Let me introduce them both. Amy Shapses, who's a member of Sharsheret's Medical Advisory Board, is an integrative physical therapist and the owner and founder of Flow Physical Therapy. With over 25 years of experience, she has devoted her practice to the treatment and rehabilitation of patients with breast cancer, musculoskeletal and orthopedic limitations. She received her BS in physical therapy from Northeastern, graduating magna cum laude. Prior to founding Flow Physical Therapy, Amy was the director of the physical therapy at the Iris Cantor Women's Health Center at Weill Cornell Medical College, one of the world's leading institutions of medical science and patient care. Amy has completed her certification as a professional yoga therapist. She's highly skilled in the John F. Barnes myofascial and craniosacral release technique, the Leduc method of lymphedema management, and the McKenzie method of mechanical diagnosis and therapy of the spine. Wow. With years of experience coupled with her attentive and intuitive nature, Amy is one of the leading physical therapists in her field, devoted to the physical and emotional transformation of her patients. Our second speaker tonight is Tracey Hecht. Tracey has dedicated her career to the health and fitness industry. She holds a cancer exercise specialist certification, earned her master's degree in exercise science, and works as a fitness coordinator at the David Posnack JCC in Davie, Florida. She holds many certifications, including NASM CPT, a SETI cancer exercise specialist, an RRCA running coach, and an AFAA group fitness instructor. At the age of 25, Tracey learned that she was BRCA1 positive and was diagnosed with stage 3B triple negative breast cancer in May of 2020. After receiving support from Sharsheret throughout and after treatment, which ended in 2022, Tracey wanted to give back by joining Sharsheret's Florida Community Advisory Committee. Tracey actually also ran the Chicago Marathon in 2022 as part of Team Sharsheret. So both are dedicated to their fields, incredibly dedicated to their fields, and very involved with Sharsheret. And we are grateful to have both of them here. I am going to bring Amy up to the screen first, and she's going to be our first presenter.
Hi, thank you so much for that introduction. I'm so happy to be here with all of you again. I've presented over the years for Sharsheret and happy to continue to be partnering with them to help patients all over the country, everywhere and everywhere else they are. So I'm going to share my screen now to start the presentation. So we're talking about today, I'm talking about today, debunking the myths of lymphedema and exercise. So myths 101. In all my years of practicing, these are some of the things that I've heard from my patients about what their doctors tell them about lymphedema or the concern of lymphedema. And maybe some of this will resonate with you. And if you'd like to put in the chat something that you might have heard from your doctors or not about lymphedema, please don't hesitate to do so. Never lift heavier than 5 pounds for the rest of your life. Exercise will overload your lymphatic system and cause the swelling to get worse. That's nothing. You go to the doctor, you complain of achiness in the arm, your shirt feels like it fits a little differently. Oh, that's nothing, and there's nothing you can do without referring out to a specialist like a physical therapist or occupational therapist. Don't ever do plank or downward facing dog. Don't shovel snow or rake leaves or wash windows. And really not acknowledging the risk and educating the patient from the get-go of their treatment. So my objectives tonight are to have you feel empowered and safe exercising, to feel that you're filled with knowledge, that you can do all the things that you were doing before, that you can push yourself to your limit, to your end, and really get and feel strong about all the things that you're doing. So firstly, and Tracey will attest to this after me, exercise is good. Exercise, especially in the patient population of breast cancer, helps in so many different ways. Just to name a few, reducing treatment side effects. When young women are forced into menopause early, there are so many other issues that you have to be concerned about, whether it's osteoporosis or muscle weakness, a musculoskeletal sort of disorder because of menopause. So you want to really, these are all amazing reasons to exercise, to reduce stress, to help with weight management, to decrease risk of recurrence, improve sleep, and the list goes on and on. So I think before we talk about sort of the evidence-based research and how it moved along, we need to talk about the evolution of the surgical techniques. So Halsted was known as the first one to do the radical mastectomy in 1882. He removed the breast, the lymph nodes, the muscles of the chest. It was pretty barbaric at the time and disfiguring, But again, if it helped women to stay alive a little longer during during their breast cancer, that's what they were doing. But lo and behold, going years on years later, they started to do modified radical mastectomies in 1940s, which is where they stopped taking away the chest muscles. They kept those, but continued to do the node dissection, which makes you at increased risk for lymphedema. Varanasi did some breast conserving mastectomies or lumpectomies in the 1980s. Toth and Lappert did skin sparing mastectomies in the 90s, really looking at how can we make a better outcome, cosmetic outcome for our patients. And at that same time, the sentinel lymph node biopsy came about. Again, decreasing women's risk of lymphedema. Now, you can't have a change in surgeries and sort of these changes and in protecting and doing no harm to patients without seeing changes in the outcome of lymphedema. But this was very slow. We began in the 1990s. There was a supplement in the Journal of American Cancer Society, which included 19 articles and 4 reports. And only one of those articles there had 4 paragraphs on exercise. So this is in the 1990s, still transitioning from the modified radical mastectomies and making the surgeries a little less harsh for the patient. So the common myth at that time in the 1990s was that exercise is dangerous. So I think I remember in the very beginning of my practicing that sort of women were told not to use that arm at all, not to use it for activities of daily living. A very difficult way to live your life. And we all know that medicine is evidence-based. So as the surgery started to change, so did our desire to study what are the impacts of exercise on lymphedema, but also how do we help patients with lymphedema. So in 2006, Ahmed et al. Looked at a randomized controlled trial of weight training and lymphedema in breast cancer survivors. They looked at over a 6-month period of time using resistance exercises and weight training for twice a week. And the results of that were that some of these people had lymphedema and some of the patients in the study did not. And the results were there were no increased risk of lymphedema, no reports of new swelling, and no symptoms of heaviness or achiness in the arm. In 2009, Schmitz et al. Did weightlifting for women, starting to look even more at weightlifting at risk for breast cancer-related lymphedema. This study divided women into 2 groups. One group was progressive weight training, and the other one was no weight training at all. And the outcome of this, very interesting, was that 11% of women in the weight training group experienced an increased limb volume, but 12% in the control groups also experienced an increase in limb volume. So we're looking at that these both of these outcomes were really no difference, but the overall benefit of the weight training was improved symptoms, increased strength, and less exacerbation of symptoms. Moving on, in 2009, Hayes et al. Did another study looking at trying to put in more, different types of exercises. What about aerobic exercise? What does that do to the patient with lymphedema and at risk for lymphedema? So they looked at, this was a supervised study looking at aerobic and resistance training over a 12-week period of time versus regular activity. Again, the outcome here was that volume measures of these 2 groups after those 12 weeks did not differ. In 2011, there was a systematic review of the contemporary literature and looking back on some of the studies, and the results again were both aerobic and resistive exercises are safe for patients with lymphedema, that slow progressive exercise is not associated with the development or exacerbation of lymphedema, and that combined aerobic and resistance exercise appears safe for patients with lymphedema. Again, just moving along and how things change with evidence, right? We needed the evidence to say, at those times when patients were thinking they couldn't do things and that it was dangerous, we really didn't have the evidence to really support that. Continuing on in 2016, another systemic review. This was 6 randomized controlled trials involving 805 breast cancer survivors, looking at resistance exercise training at high enough intensities to elicit strength gains. Again, without triggering changes to their lymphedema status. The outcome was that these patients made muscular gains, got stronger, and it did not provoke their breast cancer-related lymphedema. Now, more recently in 2024, Leanne et al. Looked at the severity of lymphedema in breast cancer survivors. And really the overall outcome of that was that, interestingly enough, they were looking for a normative guideline or an exercise prescription from the perspective of reducing lymphedema severity. So they concluded, though, that in this study, that reduced lymphedema severity may not be maintained after ceasing exercise program. So exercise should be a lifelong practice. So we're going from the 1990s or the 20th century of exercise is dangerous to all the changes and now the trials and the studies to 2024 saying, you know what, if you don't exercise, this may not be able to keep your lymphedema at bay. So a very, very big change and pivotal moment. The bottom line here is that with all of these studies, the exercise they were exercising with controlled lymphedema, use of a Garmin, and that it does not increase your risk of swelling, exacerbation, more if you did not exercise. These studies were done under controlled settings and patients were supervised. Patients in these studies were screened for stable lymphedema, so at that time you weren't having an exacerbation or an infection, and patients always wore their compression garments. This is a really wonderful story, a woman named Deborah Cordner Carson, who in her college days was an athlete. She did track and field and noticed that in her her left groin, she started to have some pain. She went to the doctor, they looked at it, they thought it wasn't anything to worry about, but because it was hindering her athleticism, she asked to have it removed, or she had it removed. And after a few months, lymphedema ensued. But here you see her wonderfully and positively in 2012, way beyond her college career, wearing lower extremity wraps on that left leg. But squatting, if you know, these plates on each side are 45 pounds each. So if you multiply that by 4, it's 180, plus the bar itself, which I believe is 35 pounds. So she's squatting here as a CrossFit ranking international and national champion, 215 pounds. So really taking care of your limb, making sure it's wrapped, the sky is the limit. Exercise, activity, and risk. So what do you need to think about when you're doing certain activities? You want to make sure that those activities don't take you above your daily set point. Seasonal activities are a little tricky, not only for lymphedema, but for low back pain. But spring cleaning, the first snowfall, you're shoveling snow, the first day in the garden, taking and pulling out weeds. If you're not ready for it, and if you haven't been to the gym or conditioning that arm over time, it might be a risk for you to start doing it on this day. And episodic activities like moving, lifting heavy boxes up and down stairs or into your bedroom or kitchen. Again, another thing to think about with risk. So, how do we manage the risks? You want to be prepared for each task. Wear your compression garment. Be mindful of how your arm feels at that present moment. Think about how heavy is that box and am I ready for it? And when was the last time you were at the gym? Really conditioning that your arm. Know what you're doing. So if you're at the gym and there's new equipment, you want to be very familiar with it. So you use a trainer there or an exercise specialist like Tracey to help you with that. Be careful and have a plan, right? And always check in with your medical team. Exercise precautions. You want to protect your limb during activity and exercise. If you have to strain, you may be doing too much. I've had a patient who was very much into CrossFit and exercise and wore a sleeve experimentally because of the surgery she had, but did do a bit too much in one of her classes and felt this tightness, heaviness in her arm. So I did some manual lymph drainage and I instructed her to continue to wear her compression garment until that arm calmed down. You want to watch out for any onset of pain that worsens with exercise. Hydrate well before, during, and after. And when in doubt, contact your physical therapist or who's ever treating you after breast cancer for either lymphedema or rehab. General guidelines for exercise is to consult your physical therapist or occupational therapist or exercise specialist. Start slowly and progress slowly and incrementally. So building up that strength, building up the muscles around, have a good warm up and cool down. And don't forget the importance of deep breathing. The diaphragm acts as a pump to help mobilize and pump lymphatic fluid like muscle contractions. So deep breathing during your exercises and throughout the day is really helpful and beneficial. And I'll let Tracey take over and talk a little bit more about specifics of exercise.
Thank you. That was an amazing introduction. And actually, introduction is not the right word. It was an amazing amount of information. And I know that Tracey is going to complement that. So I am going to put her in spotlight and she's going to share some of her slides. And just to note, I see a lot of questions in the chat box. I'm making note of all of them and we'll ask them soon. Welcome, Tracey.
All right. First, I just want to thank Sharsheret for having me speak, and I hope everyone's been having a great week. All right, let me get my screen up. Okay, so to get started, maybe go forward. Okay. I joke that with technology, I feel like I'm 97, but it's not actually a joke. Okay, so what is exercise oncology? It's kind of come out as something new, but exercise oncology itself is physical activity to enhance the lives of people with cancer and cancer survivors. Exercise comes into play in many different stages of a cancer journey, and I use quotes because I don't actually love that word for it, but there's not much of a better one. So I'll be talking about how it can benefit you prior to having cancer, throughout cancer, and how it relates to lymphedema. All right, so exercise oncology. What is physical activity? It is any movement that uses skeletal muscles and requires more energy than resting. So it's measured in METs, and it's called the metabolic equivalent of a task, or a MET, and it's characterized by the intensity of your physical activity. So 1 MET is the rate of energy expended by sitting on the couch. Light intensity activities expend less than 3 METs. Moderate intensity are 3 to 6, and vigorous activities expend 6 or more. Just some background information. Contraindications, side effects, and recommendations for exercising during cancer treatment or after. There are many, as you can expect, but these are just a few. If you have a PICC line, you want to avoid resistance exercise of the muscle in that area. You don't want to swim because it's technically an open wound, and if you get any bacteria in that PICC line, it's going straight into your blood. If you've had IV chemo, you don't want to exercise for the next 24 hours. I will say with an asterisk that a simple walk, if you're feeling well enough, is fine. If someone has bone metastases in their spine, you don't want to do axial loading. That's loading on the spine. You want to avoid lumbar hyperflexion, which is bending forward all the way, or hyperextension, which is bending backwards all the way, and high torque rotational movements, so moving with a lot of force side to side. You want to basically refer to your specialist, your doctor, physical therapist, cancer exercise specialist, to know what you can and can't do. Okay, so this is one slide that's going to cover a bulk of my information. So as far as before treatment, there is a direct link of 10 to 20% decreased risk of a diagnosis of cancer for women who exercise regularly. I mean, there's been so many studies about how much exercise can help contribute to decreased risk of cancer. So during treatment, or excuse me, before treatment, being diagnosed with cancer is life-changing, and engaging in physical activity can help mentally and physically prepare patients for what lies ahead. So that's before treatment, after diagnosis. During treatment, so this involves radiation, chemo, oral or IV, immunotherapy, there's a lot of stuff. Continuing to exercise through treatment will reduce the possible side effects like muscle wasting, which is when you lose muscle because you're not being as active, fatigue, and insomnia. Cancer aside, there have been many studies that show that exercise helps with energy and helps with your sleep. It can also help improve your balance and thus reduce your fall risk, minimize depression and anxiety from the endorphins that are released, boost your immune system, and boost your self-esteem. You're working out, you're feeling good-ish about yourself. For myself, I tried to continue exercising as much as I could safely during my treatment. And it's really what kept me feeling more like myself than just about anything else during that time. After surgery, so it's very important to note that different surgeries and reconstructions will have different recovery periods and restrictions. As far as if you have a deep flap reconstruction, your ab muscles are very much impacted. That's going to be different than an implant reconstruction. I have implants under my pec muscles, and so I've heard before, oh, you'll never be able to do push-ups again. I can do push-ups just fine. Took a while to get there. You have to do it gradually, but it's possible. So physical activity can help safely improve range of motion and muscle imbalances after surgery. As you can imagine, I had, I think 15 lymph nodes removed from my left arm I couldn't do anything with it initially after recovery. It's weaker, right? So there's going to be a lot of imbalances to smooth out. It will. Oh, sorry, I lost my place. Cancer exercise specialists are trained to develop safe and progressive programs. And this is a great way to continue to progress physical activity after traditional physical therapy, or maybe alongside it if you're cleared to do so. It can be possible to return to your previous level of activity, or even better. I've got a friend who I call my cancer mentor. She was a runner before cancer, but now she's like a 5-time Ironman, like the whole long miles of swimming, 1,000,000 miles of biking, and then a full marathon. So it's totally possible. I've done 5 full marathons, 3 of which were after cancer. Whoops, lost my place again. Okay, so palliative care. It's not the same thing as hospice, but in what I'm talking about, let's just put them on the same level. Assume that I'm talking about both. Dame Cicely Saunders, the founder of the modern hospice movement, said, "You matter because you are you. You matter to the last moment of your life. We will do all that we can, not only to help you die peacefully, but to live until you die." And every time I read that, it gives me chills. So exercise can help a terminal patient remain as active and as independent as possible for as long as possible to increase their quality of life. Palliative care is all about improving quality of life, and exercise can be a huge part of that. Long term, so many studies show that regular physical activity is linked to increased life expectancy after a cancer diagnosis. Exercise is recommended for cancer patients and survivors by the American Cancer Society, American Institute for Cancer Research, ACSM, and the U.S. Department of Health and Human Services. Sorry, past my bedtime. Okay, so now we're going to talk a little bit more about the lymph system. So your lymphatic system, here's just a little bit of science, is a network of organs, vessels, and tissues that work together to move a colorless, watery fluid called lymph back into your circulatory system, your bloodstream. It collects excess fluid from your body's tissues and returns it to your bloodstream. This supports healthy fluid levels in your body. Your lymphatic system also filters out waste products and abnormal cells from this fluid. It helps your body absorb fats, so most nutrients can travel through tiny openings and pores in the walls of your capillaries, and your body can then absorb and use them. But certain fats and other molecules too large to travel in this way, your lymphatic system can collect from your fluid from your intestines that contain those molecules and transport them back to your bloodstream. That way, these fats that you need are getting to the organs that they need to get to. It also protects your body against invaders. Your lymphatic system is part of your immune system. It's a huge part of your immune system. It produces and releases lymphocytes, which are a type of white blood cell, your fighter cells, and other immune cells. These cells look for and destroy invaders, such as bacteria, viruses, parasites, and fungi that might enter your body. Okay, so why we're here, exercise and lymphedema. Exercise is associated with a lower percentage of body fat, which helps lymphedema. Fat can make it more difficult for fluid to pass into the lymph vessels, which is how excess body fat can possibly increase lymphedema or the risk of lymphedema. The lymphatic system is stimulated by the pumping action of the blood vessels and muscles. So improving your circulatory system will be helpful for the lymphatic system. And as Amy mentioned with the breathing, one of the most important but often overlooked components of exercise is breathing. So the diaphragmatic breathing that Amy mentioned is what I'm going to get into here. So breathing helps move your fluid through a gentle pumping action in the abdominal muscles. When you breathe in using your abdominal muscles, the pressure in your chest cavity changes because your belly moves your diaphragm. So that's why it's called diaphragmatic breathing. When you exhale, the pressure changes again, And this back and forth in the pressure acts like a pump on the large lymphatic trunk that runs through your chest cavity into the venous system of your neck. So that pumping is part of what gets some of that fluid moving. So we can practice. You're going to sit upright, put a hand on your chest and your belly, take a deep breath through your nose, and exhale through your mouth, flattening your belly and squeezing out every little bit of air that you have. Emptying your lungs completely will automatically stimulate a diaphragmatic breath. So breathe in through your nose. Let your belly expand. Breathe out again and make sure your belly flattens while keeping your chest still. Try a few more breaths this way. It's not necessary to breathe in a giant breath, just one that goes to the bottom of your lungs while your chest remains still. Imagine a balloon in your stomach that inflates when you inhale and then deflates when you exhale. If you've undergone a lymph node dissection or radiation, it is recommended to take measurements of all possible sites for lymphedema. If you're in physical therapy, you may already be having this done, hopefully. If there is significant swelling after a workout, you not only want to see your doctor, but it might also suggest that your intensity or duration of your workout was too much. So after being medically cleared by your doctor, you can go back to exercise and reduce the intensity and duration, possibly. And then make sure all progression from there on out is very gradual and that swelling is monitored. So my own story of this is I do have lymphedema, wearing my really cute sleeve. I've gone to physical therapy. I've worn all of the different compression garments. I use a pneumatic pump daily to help get that out. I do manual massage daily. My swelling ebbs and flows. It gets worse if I'm sick. Sometimes if I do too long of a run, it feels heavy. My bottom line is I just need to know when to back off, when I can progress forward gradually, or when I need to go back to PT to someone like Amy. So this is a flyer. I'm not going to go over all of these different exercises, but as a cancer exercise specialist, you learn at the beginning, or excuse me, you learn exercises and stretches like these to give to the clients at the beginning of their workout. These exercises help prevent lymphedema or help reduce the risk of increased lymphedema from the workout that you're about to do. So you want to do a 5-minute warm-up and then some of these exercises. Now these are for upper body. There are more for lower body. If you've had lymph nodes removed from your torso, there's a whole other host of things that you can do as far as stretches and warm-up, but we've got limited time. So thank you. This is I'm finally done running the Chicago Marathon face as part of Team Sharsheret. Very excited. I'll be running the Miami Half Marathon in February, again, as part of Team Sharsheret. And just a few of my resources, but most of it is from my handbook. So I will stop sharing. Thanks again.
Amazing. Yes, thank you so much. I'm actually going to bring everybody back up. Okay. We have so many questions. I've been trying to organize them, but people have not enough information about this and want it. So I'm so glad we did this. Okay, I'm going to let the two of you figure out, unless it's very obvious who's going to answer, but I'd like to get in 15 minutes through 20 questions, so keep that in mind. So one is, if you're post-mastectomy and you haven't received a referral for like just an evaluation, initial measurements, things like that, should you be proactive and ask for one? Or if you didn't receive one in general, that means you're doing okay?
I mean, You had to
This is sad.
absolutely
I know.
advocate. You have to advocate for yourselves. I can't tell you how many patients come in and say, my doctor never mentioned it. I heard it from a friend of a friend. So you just actually in all different states, I've talked about this, but in New York State, you have direct access to a physical therapist. You can either see them for 10 visits or 30 days, whichever comes first. Every state is a little different, but quite honestly, you find a physical therapist, you can ask your doctor for a prescription. You do not absolutely need one to go, but you must advocate for yourself to get the help that you need. And sad but true. It's you kind of have to do it on your own.
Is it true that in some places that now it's become a routine referral, just as part, going through all the
I,
steps, 1, 2, 3, but
I
or
mean, no, I think sadly, no. I think, in France, maybe they, because I have some of my mentors are Parisian, and honestly, they have absolute physical therapy after they're out of the hospital. It is granted, just like in total hip replacements, total knee replacements, physical therapy is an absolute. In the breast cancer world, it is not. I have no idea why. It's been many, many years of me, banging my head against the wall and really advocating for women and some men about this. And that's why you just have to really advocate and continue to learn about all the different things with Sharsheret, with other groups about what can be there for you after.
okay,
Yeah.
thank you for that.
Yeah.
A lot of questions about what one can and can't do. So I guess let's start first with um, before lymphedema diagnosis. Somebody is post mastectomy, and are they supposed to be wearing garments proactively, or do you only wear those garments when there's a diagnosis of lymphedema?
Yeah, I don't recommend them proactively at all. I mean, there's really no benefit. If you're going to get lymphedema, it doesn't not happen because you're wearing the sleeve. So there's really no benefit in wearing the sleeve. Um, it is normal to have transient swelling after your surgery. This will go down as you start to get further away from the surgery. But I only recommend patient wrapping or compression sleeves when I've diagnosed them with lymphedema, because it's usually they come with the complaints and I'm the one that says yes or no. And it generally takes me a while. I would say at least, several treatments or even months to even say that it's true lymphedema. It's
Oh, that's
a
interesting.
diagnosis you do not want to hear. Um, and I do not make light of it.
That's actually
There's
reassuring.
so there's so many different reasons why you have swelling besides the lymphedema factor. It could be from the chemotherapy you had. Again, it could be just post-op swelling because you haven't been moving enough. Really depends how long out you've been. And again, I take my time in putting that stamp on a patient because it is life altering.
Anything to add, Tracy, to that?
Mm.
She's covered it.
Amy covered it.
Okay, fine. You talk about swelling being a normal part of post-surgical recovery. So there were several things that people, I'm like looking at my notes, several things people asked about in addition to swelling. And they wanted to know either A, how to manage these other things, or B, if they're indicative of an upcoming lymphedema situation. So one of them for sure is burning in the area, in the axillary area or where across the chest. Um, Another one is this iron bra syndrome. That's front and back tightness, and then cording is another
Yeah.
one. So could you?
Sure.
Yeah.
You might have to remind me of the three as I
Yeah.
talk, but the first one, the burning, is a very, very common side effect of surgery. It's sort of like it's an issue with the nerves. having nothing and no bearing on your risk of lymphedema. It's more about sort of how the body is responding to the surgery through the nervous system.
Is
This,
there a point at which, if you still have burning upon pretty normal movement, you should be addressing it with somebody?
I mean, well, hopefully they're seeing a physical therapist or an occupational therapist, and if the burning's so debilitating, you go to your doctor, you ask for a pain specialist, and gabapentin is a big drug that's sort of offered to patients who go through the burning, but it does subside over time. It's
Okay.
it's not that common. Maybe it's like 3 in 10 patients. I guess that's common-ish, or 2 in 10 that have that burning sensation.
Would itching be the same as burning in terms of healing and
Yeah, it's all about the healing process. And usually all of those feelings happen within the first 6 months of the surgery. Um, if you're still feeling it and you've never been to a physical therapist, it is time to go. You need to go.
okay?
The other
What?
aspect of the iron bra,
Yeah.
that feeling really is really about when you have mostly with expanders, because my patients who have the deep flaps do not talk about that at all. The ones that have the expanders that are either under the muscle or under the skin, you're changing the whole anatomy of that patient, of that person, where it used to be rib cage, pec muscle, breast tissue. It's now rib cage, expander, pec muscle
Or implant, yeah.
to make the breast, to reconstruct the breast. So that iron bra feeling is a thread that goes through on with so many patients. They say it in many different ways, but again, has no bearing on lymphedema risk, none.
Does it eventually go away, or it's just it does eventually?
Yes, again, you need the myofascial release work, you need the hands-on work and the movement and the exercise to get the motion back, to get the pliability and the elongation of your muscles and tissues to stop feeling that iron bra feeling. And I will say, most women will say that they have relief after they get the expanders out, because the expander is a very durable material. Its job is exactly what it is, to expand. I am assisting that expander to help patients feel more comfortable along that journey. But even when they get that switch out from the expander to the implants, there is a great amount of relief from that iron bra feeling.
That's encouraging.
And then the
Okay.
last thing with the cording, because I
Yeah.
think that's a very common thing that they relate it. So the cording is sort of like a shock of the lymphatic system, and the cords, the lymph vessels end up sort of hypercoagulating or clotting, and there's inflammation. It really has no bearing, again, on your increased risk of lymphedema, but what it does is make rehabbing or getting your range of motion back more painful and difficult on that side. Again, physical therapy, occupational therapy, start moving, exercise specialists, start moving. But yeah, I mean, hands-on work for all of that.
Okay. A couple of questions about lumpectomies or breast reductions. Do those also increase risk of lymphedema?
So the women that are at most risk for lymphedema are those who have had mastectomies, lymph node dissection, so not the sentinel lymph node, but lymph node dissection, and radiation coupled with that. Some women have to have radiation in the axilla, the underarm, which puts them even at greater risk, because it's either a dysfunctional sort of node that doesn't work anymore because it's fibrosed, so it's not allowing the fluid to clear, or it's the nodes that are removed that aren't allowing the fluid to clear. Did I just answer that question? Yeah.
I think so. Yeah, for sure. Okay. Let's switch over a second, and there's a question about what exercise that patients can do on their own, if they were going to pick one or two exercises, what would be the most helpful? Somebody asked specifically about Pilates, but anything that you can share.
Tracey, you can.
Yeah.
I would say it depends on the person, which I know is like the worst answer ever. But it depends on what you're interested in. So, when you say the best for what? Reducing the risk of lymphedema or the best for getting back
Let's say
exercising?
the best for regaining full movement and reducing risk for lymphedema.
I don't know that there's one best exercise. I would say the flyer
Was risk reducing for lymphedema. She just
okay.
put.
So the stretches on the flyer and the exercises on there, I think are super beneficial because they're going to help get the range of motion back and strength, which both help decrease the risk. And I did see that somebody in the chat asked about the flyer. Melissa, can I email it?
Yes,
Okay.
we will include it in the follow-up email, which will go out next week sometime with the link to the recording. Yeah, I saw that. That's great.
Yeah.
I actually have that flyer print or something very, very similar printed out and taped to the inside of my medicine cabinet door so that I can do them whenever I need to. Okay.
Actually, I guess thinking about it, one exercise that I think really might be one of the most important is wall walking. So this one I got from PT, but a lot of people who have any upper body anything would do is go near a wall and just walk your fingers up, and that's really going to help stretch everything in here. You can do it in different directions. Amy, I don't know if you have any more input on that.
Yeah, I mean, I think that's a very basic beginning post-op type of exercise, range of motion. When I first see a patient, that's that and some other ones, very functional type movements are what I recommend. I also recommend patients to just start reaching for those plates, reaching for that shirt up top, reaching for a cup, reaching, for whatever you can to try not to limit yourself and to use that arm functionally. So you're using it throughout the day, because stretching once a day won't cut it. It basically, you want to remind the
Good point.
tissue to be elongated throughout your day. So you want to do something every couple of hours so that as you're healing and as the scar tissue is forming, it has the impetus to be longer and elongated rather than shortened and contracted.
Thank you for that. Okay, we have time for two more questions, but one is a multiple part one, much like the cording, the iron bra, and the burning. So there seems to be a lot of conflicting information about what people with lymphedema can and cannot do. So blood pressure, blood draws on that arm, is that a problem?
I mean, it's hard to say. Again, it's not evidence-based, it's just theoretical, and it's an easy precaution like to not do. So I would, just err on that side of, it's all about the infection that would ensue.
Yeah.
It's not like that moment in time that's what's going to happen. And it's also when you're doing the blood pressure cuff, because the lymphatic system is so very close to the skin, you're really compressing those lymph vessels.
Right.
And it's just not necessary to do on that lymph node side.
Right.
So
And
just do it on the other side.
so
You know,
somebody did put in the chat that it wasn't even if there's lymphedema. If you've had an axillary dissection, just don't do it on that side.
yeah, you just might as well not. Again, it's not evidence-based, which, it's hard, but we can't put women through this, right? So you just have to sort of go with some of it, to do no harm here.
You
So
feeling the same way about manicures in a salon?
I would say to not let them use cuticle cutters and things like that.
Although, as
I
you
get my
said,
nails done.
she showed her beautiful manicure.
I
So
beat my
Yeah.
nails up in the gym, so I get them done. But
you bring your own tools.
Yeah,
I've
you
been
can
able
bring
to
it.
do that.
Yeah. Yes.
I don't, but I've been told to.
Compression during flying.
Oh
I
yeah.
mean,
Tracy's nodding yes.
well, if you have lymphedema, I mean, I
Yeah.
like compression, but honestly, compression bandaging, compression sleeves, or just a support system, but not a treatment. So compression bandaging and wrapping is a different situation. I like to tell my patients if they know how to wrap themselves to wrap during flight and to keep moving that arm. But if you don't have lymphedema, it's not anything that's going to prevent you from getting it. So I do not outwardly recommend it for a patient.
Okay.
It may be very individualized if someone has a ton of risk factors, and the sleeve is well fit and customized to them, maybe, even if they don't have lymphedema, but more often than not, I do not recommend it, if you do not have lymphedema.
Somebody just said dissections on both sides.
I
Where
knew someone was going to come up with that one. Oh,
blood
yeah,
pressure, blood draws,
I
help
know.
her.
I know. Yeah, I mean, again, all of this is theoretical, and it's not like I've never heard a story in the over 20 years that like I ended up getting lymphedema because I got, someone used a blood pressure cuff on me. It's just a way to be as safe as you possibly can be. I mean, if you do not have a choice, I would go with the arm that feels best, that maybe, yeah, I mean, yeah, that feels best. Sometimes they can do your blood pressure in your calf, your leg. I'm not sure how many doctors or, in that setting have enough patients to do it like that or have the blood pressure cuff big enough. But, again, there's no evidence behind it. It's just the idea of what could possibly impact that.
What a frustrating place to be
Yeah,
for those of us
I,
who are
I was
at
thinking it
risk.
while I was saying it.
Yeah,
I was
but
like,
it
there
is what it
must be
is.
someone. Yeah, there must be someone that has both arms, but yeah.
Okay, super. We have one time for one more quick question. This one goes to you, Tracy. How do we find a cancer exercise specialist?
It's a great question. So the website for the certification, it's a Cancer Exercise Training Institute. If I think it is ceti.org, but Melissa, I'll let you know for sure to put in the mailer. You can search for the specialists.
And I'll give a shout out. Like Tracy, you work at the local JCC, and Charcheret partners with many JCCs and we've encouraged them to get someone trained specifically in that. So reach out to your local JCC fitness center or your local gym and ask and say you don't just want someone who knows how to do it. You want someone who's certified.
Right.
It's really amazing what they know when they're certified. We also partner with an organization called Two Unstoppable that does a lot of online courses specifically for those who have been impacted by cancer.
Yeah, a lot of us do virtual training as well. In person is optimal if you can get in person, so we can really look at your form and help correct you better. But virtually is also an option.
Yeah,
I'd like to just say
absolutely.
one thing before you
Please.
end this program. I see there's a ton of questions in the chat that you hadn't been able to get to. If you can print them out or write them down, I'm happy to continue to answer those questions as, part of being on that medical advisory board. Anything that I can do.
Very generous. And we will. I will
Yeah.
save the chat and create a list of questions for both of you, and we'll include the list of the image of exercises that Tracy's referred to. Right. And the St. Louis J has 2 instructors certified by SETI. That's in fact who I was thinking of when I said that. Okay. I wish we could keep going, but it's time to wrap up. And I want to remind you that Charcheret actually has several unique movement opportunities, including yoga and movement program. Our next music and movement, which is sometimes also known by the phrase ecstatic dance, is sort of guided but not instructive dance or movement in general. And we have had people like on the screen going crazy, and we've had people in bed just moving their arms because that's what they can do. And there's no right or wrong. So definitely encourage that. The next one's January 5th, and registration will be open soon. The Sharsheret website also has a section devoted to movement and healthy living. It includes an assortment of movement videos, including one specifically for lymphedema, as well as blogs, articles, and more. The link to that is going into the chat, just went into the chat box. Thank you, both Amy and Tracey, for sharing not only your expertise, but clearly your passions with us tonight. I believe you inspired all of us to move just a little bit more. Once again, I want to thank our sponsors for this important webinar: Sherry Helfand Wiener, Daiichi Sankyo, GSK, and the Cooperative Agreement 240061 of the Centers for Disease Control and Prevention. Going into the chat box right now is a link to our survey for tonight. Please take a moment to fill out the survey, because it really will inform the types of programs we do around this particular topic in the future. If there's a particular kind of movement program you want, please put that in the notes. If you want another webinar on a specific aspect of this, let us know that. And finally, always remember that we are here for you and your loved ones. We provide emotional support, mental health counseling, other programs like the movement ones to help you navigate the cancer experience before, during, and after. All customized, confidential, and completely free. And of course, don't hesitate to be in touch with us for any reason. You can do so at clinicalstaff@sharsheret.org, which also just went into the chat box. We'll put the SurveyMonkey link in one more time. And thank you all for joining us.